Found it. All right. So good afternoon, everyone. My name is Amanda. I am one of the pre-med advisors here. Thank you so much for joining me today for our Anatomy of an Applicant workshop. Probably should have done this before I started recording, so I'll hit pause. But first thing I'm going to have you do is go ahead and scan this and sign in. So that we okay. All right. So learning outcomes for today. We really want you to understand kind of holistically what a competitive or an ideal applicant looks like, and develop an understanding for how the AAMC competencies are used in the application to demonstrate your well-roundedness, your competitiveness. We'll describe which of those competencies are implied throughout the application process and which ones you have to be a little bit more explicit in terms of pointing out, and where might be some really great places to do that in your application. The hope is that as you're learning about these competencies and you're thinking about yourself and kind of where you're at in this journey, that you're able to identify some areas that you're really strong in, and then also identify some areas that there's some opportunity for growth in. And then depending on how much opportunity for growth you have after thinking through this, maybe scheduling an appointment with one of us to talk about how that kind of changes your trajectory in terms of applying for medical school. I mean, you could even do this with dental school too, right? So really, the more you put into this workshop, the more participation, the more undivided attention you give it, the more you're going to get out of it. It's not possible for me to give you black and white answers about a lot of this stuff, because a lot of it's contingent upon, you know, you going and doing that really hard work of evaluating yourself, and being honest with yourself. Because a lot of times when we go to people that we love, our parents, our guardians, our siblings, sometimes even our mentors, they're not 100% honest with us about like where we're at with things. And sometimes they're just not in the know enough to say anything more than what they say, right? You know, our guardians always think that we're great at what we do and that we're going to be successful no matter what. So if you are a first or second year, this workshop should really be able to help you ID some things that you want to add to your plan, that you can adjust moving forward so that you can continue on whatever this timeline is that you've set for yourself. If you are in a third or fourth or even a post-bac situation and really trying to decide whether or not this is the year that you should be applying, really we hope that this workshop kind of affirms that readiness or helps you say, you know what, I do think I could benefit from one more year before I submit that application. So that's kind of where we're going today. So let's talk a little bit about a big picture, what an ideal medical school candidate looks like, right? We know that someone being admitted to medical school is going to have strong academic performance throughout their application. Where do we see that evidence on the application of strong academic performance? Where do you think? Feel free to unmute yourself, or I have the chat. I can open up the chat over here and see it. But where do you think on the application for medical school, MD or DO? Sure. Yes, absolutely. GPA is going to indicate strong academic performance. Yes, MCAT score, right? And remember that the application is going to break down that total MCAT score into subsections. So medical school admissions committees are going to be able to see where you're even across the subscores, where maybe you are higher in one area than others, right? Are there any other places that you might be able, from take on that admissions perspective, be able to identify strong academic performance? Absolutely. Looking at the course combinations that you've taken, right? Like if you're taking, 10 credits of science or 9 or 10 credits of science every semester, or like an Orgo 2 and Physics 1 combination, that's definitely going to be more rigorous than, 3 psych classes and a science course, or, 1 science course and an English course and, whatever it is. Maybe the number of credits that you're taking. Sure. So like the semesterly makeup of the classes that you're taking can lend to strong academic performance. Sure. Anywhere else that you can think of that it might be kind of implied or indicated? What do you think about research? Do you think research has any relation to academic performance? I'm going to take the silence as a, I don't know, right? Well, research isn't directly related to academics. A lot of times we are being asked to apply some of that material that we learn in class in a more real world setting, right? And so admissions committees can absolutely look at that research experience that you've had and what you've been able to get out of it, either growth-wise understanding of the process, understanding of the project, or maybe in papers and presentations as lending to academic performance. So keep that in mind as you're thinking about where academic performance is displayed on your application. Robust exploration of the profession through clinical experiences and intellectual development. This is a very, I mean, you obviously know that that's where we're going to be talking about those experiences on our application, right? Talking about us getting into a patient-facing clinical setting, service, right? The commitment that we have to the various communities that we're participating in outside of the classroom. Research also comes into play here, right? So this is also where we're going to start to see some of those competencies really come into the application. Significant time spent in service to others. We like to break that out and really highlight that word service, because so many medical schools are really focused on a commitment to underserved populations through volunteer work. And so making sure that we're hitting that point strong, that all of the applicants that we see successfully admitted to one or more schools have a strong portfolio of service in their application. The ability to think critically and inside and outside of the classroom. So again, coming back to that research idea, coming back to leadership here, right? Leadership takes a lot of critical thinking, a lot of evaluation of circumstances that you're in. Finding ways to talk about the leadership opportunities that we've had through student organization involvement, maybe in research, maybe at work, maybe through growth within positions at a clinical volunteering position, right? That's also going to demonstrate some of the things that an ideal medical school candidate has. And then meaningful growth in self-assessment. Medical schools also want to know that you're willing to take a look inward and identify where you're very strong and where you have the opportunity to grow, and come up with a plan for opportunity for growth so that you continue to be this learner that's striving to be the best that you can be. Okay, so this is really kind of how we describe an ideal medical school candidate from that meta perspective. So the competencies now, you've heard, I'm sure Laura and I throw around that word a lot. We have infused it into our pre-med essential sessions now, because it's really a buzzword that comes up a lot when admissions are talking to prospective students, when admissions committees are talking to prospective students. As we are attending our professional development sessions and conferences, a lot of the sessions that are offered to us are about how we are speaking to students about the competencies, where that discussion and how that discussion is infused in our advising appointments. What kind of opportunities are we offering for students to learn about what the competencies are and where and how to demonstrate them throughout the application process. So there's 15 core competencies, and really they come from the real deal. They come from the AAMC, which is the Association of American Medical Colleges, or is it the American Association? It's the Association of American Medical Colleges, I think. I always get the A's flipped. So they kind of spearheaded this project and asked several medical schools to come on board when deciding what are really like the qualities or the traits that we want an ideal candidate to be able to show us that they've worked on throughout the course of their preparation for medical school. Okay. The anatomy of an applicant is a tool that was developed by the AAMC as a result of these competencies. See if this is the link. No, this isn't the link. And it's really designed as like a workbook or a tool that applicants can use on their own to do some self-assessment. I'm gonna see if I can find it, because I didn't have the right link. Nope, I found it. Okay, so in the chat, I'm gonna drop a link that'll take you right to the PDF of this workbook, so that you can download it and save it to whatever device you're on. You know, if you do open it and you take a scroll through, it includes an introduction, but it also does a really nice job of talking about like where are parts of your application that tell medical school admissions certain things about you, because that really plays into the competencies. And I think that's really worth a read, so that you get an understanding of when someone's sitting in that chair of an admissions office and evaluating all of the applications that are coming in, where are they looking for certain things? Okay. It goes into the competencies and what they mean, which is what we're going to do in just a second. And then those planning worksheets is what I'm referring to. There's a planning worksheet basically for every single one of the 15 competencies. And if I were you, I would take, one a day and spend 15 minutes kind of thinking through where you're at and what different experiences you've had that really support either your not mastery, but your growth in that area, or that it's an area that you really need to grow in. Okay. I think it's really important to remember, because a lot of students, when we start to talk about these and say that there's 15 and they know that there's 15 spots on the application, I think it's really important to remember this is not a 1-for-1 scenario. Okay. It's not one competency for experience number 1 and one competency for experience number 2. The more you begin to look at these competencies, I think you're going to quickly see that one experience that you've had outside of the classroom, maybe it's volunteering at multi-clinic or Huda Clinic, is going to hit on so many of the different competencies. So really some of this conversation is about how do I know, or how do I decide which competencies to highlight in which experiences, right? And that might be some work that you do as you're preparing your application. But I think it's important to remember it's not a 1-for-1, and that not all applicants are going to be equally as strong in each one of the 15 areas as another, right? And you don't have to be a strong medical school candidate. Again, you need to be able to look inward and say, this is an area I've had some growth in. I know that there's still so much more for me to do, and here's my plan for that. Or I think I'm doing really good in this area because here's experiences A through Z that I've had that really allowed me to engage, evaluate, and reflect and assess, right? Strength are a result of your experiences and your journey, no one else's. So again, as much as we preach that no two applicants are going to be the same, I'm going to say it again, because not everybody's doing the same things outside of the classroom. Not everybody's taking the same set of classes. Not everybody's engaging in the same kind of research, right? So everybody's different, and therefore your strengths are going to be different, and your strengths are going to be displayed in different parts of your application and different experiences that you've had. Okay, so let's take a look at the competencies individually. The AAMC divides them in kind of like 4 subcategories. So first we have interpersonal competencies, and this includes service orientation, social skills, cultural competence, teamwork, and oral communication. In terms of service orientation, they're talking about someone who really demonstrates the desire to work with other people, and their sensitivity to that other group of people's needs as they're working through them. Okay, so I'm sure just by hearing me describe that, you can think of a couple of circumstances in which either friends or yourself have been really engaged in service in the community, giving back to a particular group or a particular organization, and having to kind of take a step back and evaluate where your differences and similarities are, so that you can be sensitive to some of those differences if needed in certain circumstances. Right? Social skills demonstrates an applicant's awareness of others' feelings and needs and goals, and the way that behavioral cues come into play as you're interacting with people. So this is directly related to that next competency, cultural competence there. Applicants need to be able to demonstrate their knowledge of sociocultural factors and how those factors are going to affect interactions across the board, right? An applicant will show appreciation and respect for those differences and be able to, I'm sorry, I want to make sure I write down that student just entered so that I add her to the attendance. Okay. So talking about cultural competency, able to identify what those factors are, take them into account in interactions, appreciate and respect diversity, engage in and learn about some of the differences in the way that cultures and traditions are celebrated, in the ways that you within the populations of people that you work with that might be different from yourself. That can make all of the difference when you are working with a patient who has, different beliefs and values than you do. Think back to a time where, maybe you've been with a provider and they did a really good job of taking notes about some personal things the previous time that you were there, and they came back in and really worked to make sure that those special details about you are worked into the communication that they had with you. That makes you feel special. That makes you trust them. That makes you, believe what they're telling you, because they've taken the time to get to know you. So that cultural competence and those social skills are really, really huge, really, really huge in the way that a good physician is going to interact with patients. And so therefore medical schools want to see you be able to do that, or at least have a start of being able to do that early on in this process of becoming a doctor, right? I think teamwork and oral communication are pretty self-explanatory. I will drop a link in the chat that gives you a description, an official description of all of these after I'm done going through them, but I'm not going to take the time to go through those, okay? Then we have the intrapersonal competencies. And I think some of these are a little bit harder for students to identify through the experiences that they're having. So as I'm describing them, I want you to kind of think about what are some of the things that I've done outside of the classroom that may allow me to talk about these. The first one is ethical responsibilities to others. And this is when an applicant will behave in an honest and ethical manner, cultivates personal and academic integrity, adheres to ethical principles, following rules and procedures that are outlined for them, resists peer pressure to engage in unethical behavior, encourages others to behave in a very honest and ethical manner, right? A couple of things that I can think of throughout my experience in advising that really relates to ethical responsibility to self and others. Academic dishonesty and academic integrity, right? Sometimes, you know, we're in big science classes and it seems like a good idea to start a WhatsApp chat and talk about things that are going on. And then, you know, a copy of a test comes up, right? And that gets pulled in there, right? Like, what happens in that situation? How do you demonstrate your ethical responsibility to self and others in that situation? Another circumstance that comes up a lot when we're thinking about this particular competency is medical mission trips, right? Medical mission trips are great experiences, but all too often, more often than I'd like, we'll hear stories about students that are asked to engage in procedures, medical procedures that they normally wouldn't be asked to partake in back in the United States, right? What's wrong with that? Why do you think that relates to the ethical responsibility competency?
I don't really understand what you mean. Like, what kind of procedures are you talking about?
Sure. An abortion, let's say. Extraction of teeth. Delivery of a baby. Right? A lot of times the students that we see going on these medical mission trips are volunteer. They don't have any formal training in any kind of medical assisting or anything. But on these medical mission trips, they're given the opportunity to assist, not just observe, but assist. And that's really exciting, right? Because those are the things that you want to be able to do. Deliver a baby, extract a tooth, right? But is it ethical for you to perform that? Even, you know, you wouldn't be able to do it here. Is it okay for you to do it somewhere else that isn't this country? You know, I think that's where I'm asking, like, what do you think about that? How does that relate to ethical responsibility? Great comment in the chat. It's dangerous. It can contribute to the unintentional harm of others. Sure, right? And while it might be exciting to have those opportunities portrayed to you, if you're not allowed to do it here because of laws and protection of patients, right? It's probably not something important, probably not something you should engage in, you know, wherever else it is that you are. Does that make sense? I'm trying to think of specific examples where this competency kind of comes up and we might be able to demonstrate our ethical responsibility.
Yes, that does make sense. Thanks.
Right. I was gonna say, I don't know who asked that question, so I don't know how I can. Yeah, so another comment, just I guess like that particular circumstance that I'm describing of, you know, extraction of teeth or delivering of a baby or a surgery even, right? Stitching someone up after surgery, right? It's wrong right off the bat because we have no experiences, right? Like, how do you know you might not screw that up or stretch a stitch too far? I don't know. Like I have no medical experience, so I don't know, but yes, exactly. Yeah. Reliability and dependability. So this is a competency where medical schools are looking for applicants to demonstrate that they are consistent in fulfilling obligations that they've taken on, that they've agreed to in a timely and also satisfactory manner, right? That you're living up to the expectations that are given to you by your employer, by your educator, by your academic advisor, by your parents, whatever, right? And you also take responsibility for the obligations that you've taken on. I think a great way to demonstrate reliability and dependability is by holding down some kind of experience for an extended period of time, making a long-term commitment, maybe to a part-time job. And even, you can talk about your reliability and dependability being rewarded if you're promoted within that part-time job, or maybe promoted within that volunteer commitment that you stick with, right? Resilience and adaptability is when, an applicant is able to demonstrate that they can tolerate a stressful circumstance or environment and adapt, right? A lot of times students will talk about this in maybe leadership, where they're organizing some kind of event or fundraiser or networking night, and things just don't go their way on the day of, or not as planned on the day of, and having to, bounce back and adapt and make sure that the event goes off. I think another place that this might come up to discuss is in research, right? We have no control sometimes over the projects that we are testing ourselves, or the projects that our PIs are engaging in. And we're asked to do things that we, fail at doing because we didn't know the right procedure, or we were guessing at the formula, or whatever it is. And that's a big learning curve that we have to have. Some people will be very discouraged by that, and others will say, you know what, okay, it didn't happen this time, but it didn't feel good when it didn't happen. It feel good being wrong, but here's what I've learned from that, and here's how I'm going to change things up to try it again, right? Capacity for improvement is when an applicant is continuously setting goals to get better at something. It could be learning new concepts. It could be engaging in reflective practice for yourself so that you're becoming a stronger, a more well-rounded applicant. Recovering from setbacks. So again, that research example could really pull into here and tap into both of those competencies. So there are a lot of opportunities that aren't maybe that you can talk about, or reference these competencies in your application throughout the experience descriptions and the personal statement that you're writing. Thinking and reasoning, I think, are pretty self-explanatory. Critical thinking, right? Quantitative reasoning, scientific inquiry, and written communication. Those can be demonstrated in a variety of different ways, through coursework and grades, through research, through poster presentations, through publications. And again, none of these are required, right? But those are some of the ways that a student or an applicant might demonstrate some of these competencies. And then the science competencies, living systems, human behavior, right? A lot of those competencies come through in the classes that you're taking. Maybe some of the things that faculty are saying about you in the letters that they write because of the content of the classes that they taught to you. So some of those competencies are you're relying more on other people to maybe comment on, or are a little bit more directly implied in like the research that you described, so on and so forth. Did anybody have any questions about the competencies?
I have a quick question of what you just said about
Yeah.
how a professor who you had, they might something that they say about you might illustrate one of these.
Yeah.
So they would write that in a letter of recommendation, right?
They would.
They would, you said?
Yeah.
And then are we able to read those? Because when
Sure. So no is the quick answer. Whether you decide to store these letters with a third-party vendor or upload these letters directly to the application, they are supposed to be confidential to the writer, so that the writer feels, comfortable in writing the truth. Does that mean that some faculty members don't send a copy to an applicant? No. So sometimes they will, but technically they're supposed to be confidential. It is absolutely appropriate for you as an applicant when, depending on how you do the ask, right? It's absolutely appropriate for you as an applicant to say, hey, Dr. Maddie, I'm trying to come up with a name real quick, right? I was really hoping that you might write me a letter of recommendation for my medical school application. I've been a student in 3 of your classes. And I think that we've really gotten a chance to know each other well. I was hoping that you might comment on my ethical responsibilities to others because of this circumstance, my critical thinking, my quantitative reasoning competencies, and my scientific inquiry, right? That's absolutely appropriate. And a lot of times you'll find that letter writers will agree to do it, but ask you for like a list of bullets. And that's where you can say, if you could comment on my ethical responsibility to others as a result of this situation, and bullet it out. If you could comment on, how I demonstrated critical thinking and quantitative reasoning in your classroom, like you have that, you are absolutely allowed to do that. Does that make sense?
Yes, cool. Thank you.
Yeah, you're welcome. So I did drop a link in the chat that takes you directly to the descriptions of those core competencies. You'll notice I cheated and read some of the definitions to you instead of putting it in my own words, but sometimes it's just easier. But those are there for you to reference. I would absolutely encourage you to bookmark those. We also have paper copies in our office too. Like we said, we give them out at the pre-med essential sessions, but if you wanted to swing by and just grab a copy because you'd rather have it, you know, in a piece of paper form, that's fine too. Okay, so let's move on.
I have a quick question. I'm
Oh
sorry.
yeah, absolutely. Go ahead.
So if based on how far away we are from applying for medical school, do you guys like offer workshops to get one-on-one like feedback or like consultations for them, the applications?
So, I mean, a lot of the conversation that we have in our semesterly appointments are around this. You know, we notice sometimes that students will come in with the intention of just planning a winter or a spring, summer or fall schedule. And it'll be a quick 5-minute conversation because it's pretty cut and dry. Yes, you know, you're on your plan of work. It looks good. Grades look good. That's where Laura and I will say, okay, well, let's talk about a little bit about what you're doing. You know, talk to me about what you're doing outside of the classroom. And I mean, if you are listing for us the right kinds of things that you know medical schools typically see in applications, you're interacting in a patient-facing experience, you are just starting in a research lab, maybe you volunteer every other week at your church or at Meals on Wheels or at Cleaners, right? Then we're going to start to have, you know, we're going to ask you how long you've been there, and we're going to start to kind of dig into what are you noticing about that? What have you noticed about yourself? Are there any situations in those experiences that have stood out to you that really demonstrate your cultural competence, that demonstrate your reliability and dependability? So we will try to engage you in conversations about that. We don't have specific workshops other than this one that's going to ask you to sit down and evaluate this competency. That's really something that you've got to make the time and the discipline to do on your own.
Okay, that makes sense. Thank you.
Yeah, I mean, if it were me, and it never will be because I'm way too old and I have no interest in becoming a doctor, but I would, you know, maybe at the beginning of each semester, because we always feel like it's a fresh start, take an hour and pull up that anatomy of an applicant document and do some thinking about where you're at with things. Maybe you made a plan at the beginning of the last semester to address this gap in your application of cultural competence. You've literally only interacted with people within your community that are just like you. There's nothing that you can say that really demonstrates your cultural competence. You know, the more you put that off, the longer we're going to say you're just not ready because you don't have that component, right? So there's a lot of this work has to be on you. We're never going to say like, okay, here's the checklist. We've got all of the checks marked off. You're ready to go, right? This is always going to be like a scale thing. So does that make sense?
Yes, thank you.
Okay, yeah. So I'm going to have you do a quick activity so that we can kind of really get into thinking about these competencies. So I'm going to break you into smaller groups and I'm going to assign each group a set of competencies. So I want you to try and restate the competency in your own words and then think of a couple examples of areas maybe that you within that group have already started to demonstrate or practice that competency. And if you haven't, come up with some examples. Okay, so I'm going to stop screen sharing for just a minute and I'm actually going to stop recording too because nobody needs to hear this. Okay, so it's one thing to listen to someone talk about these competencies, but it starts to become a little more personal as we are asked to kind of describe them in our own words and relate them to some of the things that we've done or think of examples. So breakout room number 1, you were asked to describe critical thinking and service orientation. So pick one and talk to me a little bit about how you described it in your own words and what are some of the examples of ways that you've thought about demonstrating this on the application. I don't remember who was in breakout room 1, so.
Yes. Volunteering at a clinic as a possible example for, it could fall under both, but we kind of geared more towards like critical thinking, just because you have to figure out what to say or find a solution for patients, which can vary based on like their needs. So you kind of have to quickly find solutions for those and quickly adapt to however like the situation is going. Other things we thought could fall into both categories were just like leadership roles in organizations, or like mainly just in terms of student orgs maybe on campus, and how you kind of deal with different situations, again, deals with critical thinking, and in terms of service, specifically how, like, depending on like the role, or I guess the mission of the org, how it relates to serving different populations, or helping maybe like the local community or whatnot.
Sure, that's great. I'm just going to try and paraphrase because it's a little hard to hear you. You were talking about with critical thinking, kind of a volunteer, maybe a clinical setting, and having to think about the things that you've learned and also take into account the patient in front of you and what their needs are, and kind of process that very quickly in order to be able to engage with that patient and get them what they need. So I think that's a great example of critical thinking. And service orientation, you kind of described some of the service opportunities that student orgs give you on campus, and how really it was hard to separate like these two competencies, because being service oriented required you to be thinking critically about, the projects that you were taking on, and the ways that you were engaging with people in the community. So that's awesome. Good. Thank you. Breakout room 2, pick one, social skills or quantitative reasoning, and talk to me a little bit about how you described it and what kinds of examples you came up with to demonstrate those competencies.
I can go. I kind of related it in a way to sort of like customer service. So even if it's not necessarily a clinical setting, maybe you have like maybe a desk job or a front-facing job where you deal with customers a lot. That could be one way you could demonstrate that.
Sure. And I think you make a really good point. A lot of times students come into this process with the thought that they can only talk about clinical or medically related experiences that we had in the application. And that's absolutely false, right? There's so many things that all of you do outside of your desire to become a physician that allow you to practice developing these competencies. And the application is a very appropriate place for you to talk about those things. So, I talk about this example all the time of getting my undergrad degree to be a high school teacher. I couldn't get a job right away. So I had to work as a server to make money and start paying back loans and paying off bills. And the skills that I was able to engage in and practice while waiting tables really ultimately made me a better teacher, made me a better at interacting with high school students and other professionals, and maybe better at the job that I do today because I'm not afraid to talk to anybody anymore, and so there are important lessons to be learned outside of the clinical setting that you absolutely should be able to talk about, that you absolutely can talk about on your application, and talk about these competencies. All right, group 3, teamwork and scientific inquiry.
Okay, so we mostly have examples for teamwork, because for scientific inquiry, we weren't really it wasn't very relevant between all of us. But for teamwork, we came up with jobs or clubs. There's also classwork with group work with your classmates, for example. And another one was research opportunities, because I think all of those kind of relate to basically keeping each other on the same page and looking at different perspectives, just so you guys can all become equal, if that makes sense.
Sure. Yeah, holding accountability. Yeah.
Yes.
Sure, absolutely. Yeah, and like we talked about before, scientific inquiry is kind of something that can be implied through some of the information that you include, right? Again, the grades that you've earned, the research projects that you're part of. So that's something to consider is you don't have to highlight every single one of these competencies, because some of them we can just see with our plain eyes, right? Directly versus implicit. Cool.
I don't know if these are applicable. I just want to make sure we were right. For scientific inquiry, we came up with coursework or labs.
Yeah.
Okay.
That's what I was just about to say. I'm going to go back and share this screen real quick. One of the things I think I forgot to hit on. So we go back to this list really quickly. Right at first glance, you can kind of see which one of these are directly explicitly implied in the application that you're submitting, right? Like living systems and behavior is going to come predominantly from the classes that you're taking as a result of wanting to prepare for medical school, right? Written communication is seen in so many parts of the application process, the primary application, the secondary applications, the thank you notes that you potentially write afterwards, right? Oral communication too, right? They might be able to see some of this teamwork competency if they're a school that uses an MMI interview session and uses a teamwork station, right? Some of these in the primary application process have to be a little bit, highlighted or explained, like your service orientation, like your social skills, your cultural competence. Those are things that you need to bring awareness to within the writing that you do. Does that make sense? Where some of these are a little bit more like explicit, we can see them right in what we're given as in terms of application, where others are ones that you have to bring to an applicant or a reader's attention. I don't know how much time we're going to have to get through both of these, but that's okay. Let's at least do one of them. So what I want you to do right now is open up whatever it is that you were going to do some of that journaling with and take a look at the experiences that you've had thus far and but also take a look at the list of 15 competencies. And I want you to pick one of those competencies and talk that you're good at, that you feel strong in. And talk a little bit, write a little bit about what you did to develop where you're at, the level of strength that you're at in that competency right now, and see if you're able to bring in specific examples as evidence, right? You're going to hear us say a lot in this process of writing about yourself and selling yourself that you need to show, not tell. It's very easy for me to say that I'm culturally competent, right? But an admissions committee isn't going to believe me unless I'm able to show that cultural competence through the telling of an example, right? So I'm going to give you like 3 minutes. I want you to, again, look at that list of competencies, go into the chat, it's linked there. You can see that list and pick one that you feel like really strong in and start to write about it. How did you develop it? What evidence do you have to prove that? I'm going to stop you just for the sake of time. Would anybody be willing to share which competency they've identified as a strength in their preparation right now, and kind of what they talked about in their writing? How are they working to develop that strength? How have they developed it? And where does that evidence come from?
I don't mind saying it.
Sure.
I guess I could say social skills, which are under interpersonal competency.
Mm-hmm.
And I guess I developed these by, volunteer work or like tutoring, or always having to reach out to people and like gain kind of a communicative experience, if that makes sense. Mm-hmm. And I guess evidence through this is I was always put into environments where I was like kind of forced to speak or take the lead on things. And you just like build that, I guess, that skill of like having to kind of read the room or like feel the energy off of people, if that makes sense. Mm-hmm. And I guess it just came naturally after that.
Sure. I think that's a really great start. I would encourage you, if there is a particular experience that comes to mind that you've had throughout, since starting your undergrad preparation at Wayne State, that you feel like really highlights your strength in social skills, that maybe you write down right now, like this might be a good experience to highlight my social skills in the experience section. The way that you just described that, it also could be like, one of the things, it sounds like you described an advocate, right? And one of the most important things that a physician can do for patients is advocate for them with their family, with insurance companies, with the community, right? And so maybe that's a broader theme in your application is being an advocate, and how important it is to have the skills to be one. And what's required in being an advocate is strong social skills, right? So right from that, just a little bit of reflection, you've kind of been given some things that you can think about as you continue to develop the application that you're preparing for yourself. Anybody else want to share before I move on?
Can I share real quick?
Yeah.
So I work at Walgreens Pharmacy and it's like retail, obviously.
Mhm.
And like a lot of patients, they come in like asking for medications and like we always run into like insurance problems. So a lot of the times, like I have to like talk with the pharmacist and other like people working in the pharmacy, make sure what's going on and convey that message to the patients in a way that like that doesn't anger them and like make sure that they understand what's going on behind the pharmacy and like that we're working on their medications to get it to them.
Mhm.
And I think like in the beginning when I first started, this was really difficult because like I didn't really know how to talk to the patients. And like they would always be like really upset. But like as I've been working, I have learned that like, you know, how to like be polite about it and like how to like explain to them.
Sure. Which competency do you think you would relate that to?
I think that would mostly be social skills.
Sure. Yeah, absolutely. I agree. In some circumstances, you said you worked at Walgreens and you didn't share more, and that's okay. But like, is the Walgreens that you work at in an area that serves a particularly large population of a certain ethnicity? Are there cultural barriers there to their access or understanding of certain things? So those are things that also could potentially play into that maybe you hadn't thought of it off the bat. So no, I think that's great. Thank you for sharing, both of you. The goal was to have you do the same thing for areas of improvement. My hope is that you're inspired a little bit by attending this, and we'll take the time to dive into these 15 competencies using the anatomy of an applicant and really start to honestly assess where you're at, keeping in mind that this is, again, not a one-for-one, that you're going to be stronger in some areas than other. But as you're doing this evaluation, if there are areas where you're like, it is crucial for me to be stronger in this one competency area, because this one competency area is so important to being a well-rounded physician. And what's your plan? What's your plan to get better in that competency area? And that's where we want you to develop some ideas about things that you can do. And if you're struggling, then come in and talk to us, right? So things to consider and next steps after attending this. There are some things that we want you to, the next slide goes, yeah. Oh, okay. Oops. Things that we want you to consider where you'll demonstrate that competency, right? Keeping in mind that there are multiple places that you may nudge at or reflect on or touch on a competency in the application process outside of the written application, right? I've already mentioned this, but secondary applications are written, right? Offer you more opportunities to talk about additional experiences or expand upon experiences. Interviews themselves within the interview day are very important, and a lot of times offer you the opportunity to highlight competencies that you're very strong in. Outside of the interviews on interview day itself is an opportunity for you to engage in professionalism, right? I will tell you, from the moment you enter an interview day to the moment that you leave, all eyes are on you. So you should be embracing all of those things that you are and that your application says that you are throughout the entire day. Second look days, potentially, right? So while I realize that the primary focus is on that first written application, keep in mind that you're going to continue to be expected to embrace and demonstrate these competencies. Next steps are really to continue to reflect and evaluate, using that exercise that we did today as a jumping off point, and then make a plan. Once you kind of are at a point where you've assessed where your strengths and weaknesses are, it's time to come up with a plan. And part of that plan should be revisiting your assessment on a regular basis. Maybe it's every 6 months, maybe it's every 3 months. But you need to continually evaluate where you're at and what else you can be doing, and where those, like, again, where your strengths are, and you can pull back a little bit. Great resources are the Anatomy of an Applicant PDF that I've already shared with you. Also the, let's see if I can pull it up. The AAMC publishes real stories of applicants that demonstrate the competencies that we've been talking about. And sometimes I think it's nice to read what other people are doing or have done to highlight all of the great things that they've done. So in the chat, the last link that I just dropped will take you directly to that AAMC webpage where there's stories demonstrating the competencies. The other thing that I will suggest for first and second years, for your first and second year, ID 2 competencies and 2 actions per competency that you can work on. Set yourself a due date and then make a check-in with our office, kind of that assessment. Did you do it? What'd you learn? Did it work? All those good things, okay? If you are third and fourth year and you have done this assessment and you've decided you're ready to apply, really our personal statement and our pre-writing and preparing workshop are what's next for you. After that, a little bit later on, closer to the open of the application cycle, the application overview. If you're doing this evaluation and you're deciding that maybe you're not ready or you're not sure if you're ready, it's time for you to check in with the advisor in your office and come up with a plan, okay? I am going to drop a link to our workshop schedule in the chat so that if you did want to sign up for any of those workshops, you can do that. It is 3:29 and we are supposed to be done at 3:30, so I can take about a minute to answer some questions. And if you don't have any questions, I thank you so much for coming today. And yeah. Free to go.
Thank you. Have a good day.
Thanks, you as well.